Hi everyone, welcome to the presentation of the final project of the class CSE 564. So I Piyush will be giving a demo of a dashboard, and my teammate Abhishek will be providing some insights and inferences that we were able to make. So the data we used for our dashboard is the government interventions data and the COVID daily data for the comparison. So we used data merging and all to provide an integrated dashboard. So so let's get started. So yeah, our dashboard aims to analyze measures taken by the different government of the countries to curb the COVID-19 infections in the country. So we used five plots. One is choropleth map, one is integrated line and bubble chart, one is PCP plot, one is stat board to show the stats of that particular selected country, and a word cloud. So we use in link highlighting and linking interaction for this choropleth map. So if I click on a country, it will highlight that particular country on the choropleth map. It is also linked with the other three plots, line and bubble chart. So it will show the daily stat of that particular country. So for the PCP plot, it will highlight that country on the PCP plot. So we can compare with some other countries and apply some more filters on it. So in the stat board, we can see the average daily cases and other stats, daily vaccinations during this particular period of time that we select from the time series plot from the line chart. And the other word clouds actually shows the trending hashtags between a particular period of time that we filter from this line chart. So if you want, so if you want to see change, if you want to change this, if we change this time series, if we filter out this, filter out the time from the line chart, so all the other graphs will be updated. So if you can see that if the choropleth map is changing as we filter out the time, and also the line PCP plot is updating, the dashboard stat board is updating for that time period. You can see that daily vaccination is getting updated from this during this time period, and the hashtag Twitter trends are also updating. So for PCP plot, we use the highlighting and brushing feature. So if we brush through the particular axis on the PCP plot, it will highlight and brush it. So it is linked with the choropleth map. So as we filter out the countries from the PCP plot, it will be highlighted on the choropleth maps. So choropleth map also supports zooming feature. So if we zoom in and zoom out on the choropleth map, we can actually get a better picture of that particular area. And the line plot also supports the zooming feature. So if we zoom in, zoom out, it will brush that particular time period for this. And and there is a drop down menu for the attribute selections. So if we change the drop down, if we change the attribute of this, it will reset. It will show that particular attribute on the line chart. So right now the India is selected, so the attribute is new attribute is showing for the India, and you can see the COVID stats is also showing. So here is also a reset button. So if you want to reset all the graphs, you can just click it. So yeah, now my teammate will provide some insights and inferences for the dashboard.
Hey, hi everyone. This is Abhishek. So I will go through the inferences and insights that we derived from this dashboard. So if you go through from west to east, we just select United States first. So here what you can see is there was huge measures initially taken by United States government initially, but later on there was a huge wave, second wave in United States during the October-November period. These were the measures that government took in United States, like public healthcare risk communication, communicating to the public, and this is resource allocation. These are the travel restrictions they took. This is social distancing measure, like they implemented very well initially, and this was the contact tracing that they have done. So currently, actually, we don't have more data above the May-June range for what measures like did government took, and so we can't actually compare and derive what actually was the cause for the rise in cases after October. So what you can do is our Twitter hashtag board is actually will give you more info about, like, if you go to that particular time range and see, like, was there something news or something reason to check for, like, the rise in COVID cases. We can actually see from the Twitter dashboard was there was hashtag Trump trending, and that particular time period there was vote trending, there was hashtag Trump trending, Biden has trending. So there was elections going on in that particular time range. So there were huge election rallies as well. So that might be one of the reasons to like there was high COVID cases in United States. To further analyze on our uh, dashboard, we can actually filter out the United States, and our PCP plot will give you further info about the United States with few more indexes. So what we can see here is, even if the stringency was on the mid range and human development index is high for United States, but the hospital per beds, or what you can say the medical infrastructure is, was less. So the cases were still rising, and the deaths were also there. So if you just drag down this axis here, so you can see there is an inverse relationship between the hospital beds getting low and the deaths getting high. So this you can derive it from the PCP plot. So now if you move to some European country and zoom in here, so we will go to Sweden. Uh, yeah, so if you see Sweden here, what you can see is there are huge green bubbles. So if you want to highlight, you can go to this green bubble as well and just click on that. So it's the risk communication. So Sweden did a very good in public awareness, but they didn't actually implemented other measures that well to curb COVID-19. So you can clearly see, like, other measures were really less that the social distancing was really less, and they ease out the restrictions. So that might be the reason for the huge COVID cases. So you can actually say, like, only risk communication is not the one of the best thing, and not the only thing you should do. There are other measures that you should also follow. To further analyze, you can actually go and select the Sweden here as well from the PCB plot and see the hospital beds availability was very less, so the cases per million was also high. The stringency index was also on the low side here. So yes, this you can derive it from the uh, for Sweden. Now if you go on to east uh, southeast, so this is India. So India, you currently you can see there is a huge COVID second wave in the April March in India. So initially the government took very good measures. So social distancing was done, contact tracing was done, travel restrictions was also imposed. So you can see the dampening of curve initially till July, but later on, as ease of restrictions came, so you can see there is a rise in COVID cases in India, and this was the second wave that came. So if you want to figure out further analysis on India, what you can do is, so here the hospital beds per thousand is very less, and India is suffering through medical infrastructure crunch right now at the moment. So this is, you can actually do and say, like, medical infrastructure is the crux to curb COVID-19 as well. From this inference, you can derive this inference from this. If you and now if you want to actually see some countries, few countries who have actually successfully curbed COVID-19 and implemented few their models, so you can go to New Zealand here in the map and see. So you can see, like, the curve went on high, and then there was a dip in the curve, and there was no such cases were there further in New Zealand. So they have done there was public health, there was risk communication, there was travel restrictions. So they have implemented everything they could in New Zealand, and I guess that is the reason there was not many cases in New Zealand. Same is the case with South Korea. They have done huge contact tracing, so you can actually see the they have the curve dampening in the initially it was high, then it was damped, but we don't have the data later on to figure it out why the curve was rising from November. uh, you can you can further do analysis with the PCP plot. The hospital beds per thousand is very high in South Korea. So, like as we said, there was inverse relationship with the deaths and cases. So you can actually see from here as well, uh, from this PCP plot. If you reset, so one more thing you can do is you can go to Delhi vaccinations as well and check. So till December 2020 there wasn't, I guess, much on the vaccination, but now from December, I guess, many countries have started vaccinating their people, and you can actually see the count here as well for the vaccination. So and one more thing I wanted to tell you, like, if we can actually see different countries model, but we can also compare the models between them as well. So if you select two countries here and check, see the United States and UK are actually following the same path on the PCP, and if you figure it out from the integrated line and bubble chart, their curve is also same. So you can do switch between this and see and compare their different attributes and check for their similarity and what measures they have taken, so that the other government can adopt from their model. So this will eventually help different governments and according to their population to take different measures and curb the spread of COVID-19. So that's it, folks. This was about our dashboard. So dashboard is multi-directional, integrated with each and every plot. So thank you very much.